If you look at the number of rural hospital closures that were happening in 2022 and 2023 and 2024, it was really accelerating. But if you look in the big beautiful bill, in that legislation, there is a multi-billion-dollar rural hospital fund to try to help these rural hospitals persevere.
They'll be out of business by then. I don't like this because they cannot function year to year. Oh, and by the way, so we're clear, on the back end of this, insurance companies are now going to create AI to tell you what can or cannot be done when people are in the hospital.
Hello, my name is Laura Schulte. I'm a reporter with the Milwaukee Journal-Sentinel. And in Wisconsin, rural hospitals are struggling. Closures are creating healthcare deserts for parts of the state. And what can be done federally to keep those hospitals open and providing necessary care to communities?
I got you, Vice President. Number one, stop cutting their funding, right? That's absolutely insane to me, right? Because as you cut their funding, a lot of these hospitals don't make a profit. That's a huge thing you all have to understand. There are nonprofits that do not make a profit. A lot of them are losing anywhere from 3 to 7% per year. They depend on government funding to stay in business. When you pull that, you put them at an even bigger deficit, then expect them to go out and do more work and provide a higher level of acuity care, which cannot be done with less money. And then, of course, they have people there that you've pulled their insurance from or made the insurance so expensive. So now these hospitals now have indigent patients are patients with no insurance and no ability to pay. So now they still have to see these people because of EMTALA.
Community members.
Yeah, I appreciate that question. It's a very, very serious problem. And unfortunately, this, like so much of what's going on in our country right now, is a problem that we inherited from the last administration.
Again, this stuff is just it's not true, right? This was not a problem. As someone who works in healthcare, this was not a problem. People were fine. Rural hospitals were intact. And I'm not saying none of them closed. That's not what I'm saying. But the reason they were closed is not because of a lack of funding. It might've been a lack of staffing. Again, by the way, you all doubled down on lack of staffing because you made it that it's now $100,000 or pretty much impossible to get an overseas nurse. And your rationale is, well, we got enough nurses here. No, we do not. No, we do not. You burned them all out in COVID. People are switching jobs left and right. You got 100 nurses a day, probably switching from nursing to real estate agents. It's a real thing. They're really burnt out.
If you look at the number of rural hospital closures that were happening in 2022 and 2023 and 2024, it was really accelerating. And it's one of the reasons why it's not a provision that's talked about as much, but if you look in the big beautiful bill, the working families tax cut, however you're calling it, in that legislation, there is a multi-billion-dollar rural hospital fund to try to help these rural hospitals.
They'll be out of business by then. I don't like this. They'll literally be out of business by the time this stuff comes around because they cannot function year to year. They'll literally have to shut down. Oh, and by the way, so we're clear, on the back end of this, insurance companies are now going to create AI to tell you what can or cannot be done when people are in the hospital. So if said doctor decides he still wants to do a procedure and they've already told you you're not going to get paid for saving this person's life, then where do you go from there?
Persevere in tough times, stay open, provide essential services, and get them to a place where they're on firmer financial footing. Nothing like that, I don't believe, Derek, had ever existed in the federal government before, but we said, look, we cannot let these rural hospitals just disappear, so we've created this fund to try to, support the ones that can stay open and try to slow the closures for the ones that are going to have to close.
Nah, the writing's on the wall. I don't have to watch any more of this. I'm going to tell you what's going to happen. I want you to follow me and share this. They are going to allow private institutions, private investors to buy hospitals. And Henry, why are you saying this? For the past 10 years, I've been owning a hospice company, and all I get every week is, can I buy your company? Can I buy your company? Can I buy your company? And I'm always wondering, the number always goes up. Why do you want to buy it? It's because they're so interested in owning every healthcare company they can. Then they bought a bunch of these companies and then figured out, well, wait a minute. If I bought this company that had 100 hospice patients, now they only have 50 hospice patients, what happened? The reality of it is you bought these companies not knowing the referral sources are what you really need to go after, right? So the hospitals are your referral sources. Again, why I say a hospital should not also own a hospice. A hospital, to me, should not own any company that it refers to because you essentially blocked out an entire pipeline of other people. And then you're saying, well, they have patient choice. Let me just say this on the record, right? I have video recordings of people being in hospitals who have tried to tell them, I want to go to Precious Hospice, and a social worker comes in and tells them, or a doctor even in one case, which is absolutely insane, explaining to them that they need to go to this other hospice because they can't leave the hospital. Now that's a recording that we have. And we're gonna have more recordings in the future. I suspect it will get up to thousands in the next couple of years. And you're saying, why is this important? Because you all need to start recording what happens when you go to the hospital. I'm just gonna flat out say it. Because long-term, what happens long-term is there's no accountability. There's no accountability. And you're asking me, what does that have to do with rural hospitals? Everything, everything. Because if I am a rural hospital and I cannot get the best doctors because I can't pay a lot, I can't get when I say best, I mean the ones who are specialty doctors or specialty surgeons that can make 600 grand here or make 400 grand here, even 350 here, a lot of times they're going to take that 600. The problem with that is this person has already spent $500,000 to actually get their degree. So you can't even be mad at them for not wanting to do that. We can't fix that system overnight, so don't worry about that. What we can fix is figuring out a way to at least make it. We got to figure out this insurance piece. That's super important because the other part of these hospital closures are people lost their insurance. So when they lose their insurance, let me tell you what happens. Instead of going to the doctor or the urgent care, you run right to the ER. So that ER visit you might not think much of it, but it's going to cost the hospital $2,000 to see you, even just for a couple hours. That's it. Whether they got to give you IVs, whether they got to have a doctor see you for 10 minutes, a nurse got to check you in, they got to get your vitals. That might be a $2,000 visit that they're not going to get paid for because of, again, EMTALA. So what are they going to do long term? I feel like if you all are in the best interest of saving lives and helping people, two things have to be done. One, and we talked about it before, you have to figure out this food situation. Now, I am all for making America healthy again. I'm just not for the way that they're trying to do it, which is an overnight process, cutting out processed foods from people who can only afford processed foods without giving them a way to actually curate another way to create meals for their households. I don't think that works long term. And if it did work, well, it definitely won't work because in the interim, you're also raising the price on housing and clothes and shoes and healthcare and daycare for their kids and kicking adults out of nursing homes and forcing them to go home and raising the cost of all these things. So to me, virtually impossible, but doable. But those are my two suggestions. Let me know what you guys think in the comments. Thanks.